Hi, I am Sumayya Spencer. I was diagnosed with rheumatoid arthritis in December of 2010. I have been on a treatment plan since around that time. My story is maybe not so different to a lot of other people who have conditions like mine, who have been seeking diagnosis for weeks, months. For some people it's years. I was one of the lucky ones, and I received my diagnosis within about, I want to say 6 to 8 months of my initial symptoms. My symptoms manifested as initially just pain in my wrist and my fingers, and the pain would be fleeting. It would last a couple of days and then it would go away. I had been to a GP, well, numerous GPs actually, because I just knew something was wrong. I was 30 years old and experiencing this unexplained pain in joints where I shouldn't have been experiencing pain. And one of the practitioners I went to did what was called a rheumatoid factor test, and it came back negative. That negative test does not indicate that you do not have the condition. It's just a test that can be done as part of determining your diagnosis, but it's not definitive, it's not conclusive. At the time, maybe my practitioner wasn't fully aware of the tests that should be done. So we had ruled out rheumatoid arthritis, we had ruled out lupus, but I was still getting this pain, no answers. I was, as I said, 30 years old. I had a young daughter. My life was changing because I couldn't comb her hair. I could barely hold a pen. I couldn't cook properly because I couldn't grip a spoon properly. So there were lots of little things in my life that were changing, and it wasn't normal, and I knew it wasn't normal, and it wasn't me. So I continued, and I was eventually referred on to Dr. Cindy Flower, who was my godsend by that point in time. And she gave me the answers that I had been seeking for months on end. She also explained to me then that that negative rheumatoid factor test was in no way definitive. She gave me a clinical diagnosis on the first day that I saw her, and she did some additional blood work, which she said would help her to continue in her diagnosis and confirm what she was already thinking based on what she was seeing clinically. Hearing that I had rheumatoid arthritis at 30 years old was scary, but there was a sense of relief in having an answer. Answers are so important when you know something is not right, but you don't know what it is that's not right. So getting that answer was very important to me, but I was scared because I didn't know what was going to come next. Initially, I was not coping well at all. I went through a period of very high anxiety because I did not know how this was going to manifest in me and how it was going to manifest in my life. And having a young child, all of that was constantly on my mind. So I was constantly in a state of anxiety over where was this going. Over the course of the years following that diagnosis, I found myself, and this is going to sound odd to some people maybe, I made friends with my condition. It wasn't going anywhere. It was a part of my life. So I had to learn to develop a cohesive working relationship with this condition that was now a part of me and a part of my journey, and learning to accept where I was at, learning to accept that there are going to be good days, there are going to be bad days, trying not to push myself on the bad days or push myself too hard on the good days to force a bad day. I had to learn to be gentle with myself. Being gentle with what I was going through was a large part of my healing, and it helped me with my anxiety is far in my rearview mirror. Not that there are days that you don't feel overwhelmed, because this condition, like a lot of autoimmune diseases, is very fickle. It changes rapidly from one day, 1 week to the next. I could be having a really bad week this week, and then next week I could feel like I could move mountains. So it's just about moving with that, flowing with that, and agreeing with what my body is telling me and listening and understanding. I would want anyone who is diagnosed with rheumatoid arthritis to know not to be afraid. There are treatment programs out there There are wonderful doctors like Dr. Flower who can help you through this. It's a matter of just finding the treatment plan that works for you, because the same treatment plan doesn't necessarily work for everyone. It's by no means a one-size-fits-all situation. So if you go in and you meet with your doctor and you do not find your medication right up front, first prescription, that's okay. It's fine. You have to work through it and find sometimes a number of medications that will work to treat you as an individual in your RA journey. But I just want people to know, as I said, to be kind with themselves, to listen to their bodies. That's very important. Even when your doctor is telling you, no, nothing's wrong, listen to yourself. If you feel that something is not right, try to push on, try to push through and find someone who can help you get the answers. And we at the Hope Foundation are excited about some of the programs that we're going to be rolling out over the next year to support RA patients or people who are living with chronic pain and they just don't have the answers. We want to be able to help them find those answers. So we're going to be pushing out some stuff to help people out there who are either already suffering or starting to show symptoms and they haven't had those answers. We don't want them to go without answers.